Critics of the White House push for health care reform say it will lead to ration care. Part of the plan would tell doctors what treatment options are available and a quota on patient care. In fact, White House Chief of Staff Rahm Emanuel's brother, Ezekiel, who's a doctor advising the White House, says the treatment should be denied to some people who presumably would not need the treatment. He includes those, quote, who are irreversibly prevented from being or becoming participating citizens. An obvious example is not guaranteeing health services to patients with dementia. Translation, your relationship with your doctor could change. I want to bring in Doctor of Internal Medicine, Samuel Fink, my guest now out of L.A. Good morning to you, Doctor. I want to talk about this, what some people call ration care. How would your relationship change with your patients under such a system?
Well, I think it would be absolutely horrible. I mean, I advocate for my patients. I have a great relationship with my patients. The last thing I want is the government in the room with my patient and I. I'm the one that decides what tests they need, what medications to give them, and what treatments are appropriate. And it's unbelievable to me that we can have a government entity in the room that's going to try to direct the way that I practice medicine. So I'm totally against that.
In terms of practicality here, just to help me understand this, would you be given, say, like 100 CAT scans a year, and you can ration 100, then after you get to 100, it's no more? Is that the way it would work?
No, I think what will happen is that we're going to have rationing. There's no way you take care of more people and spend less money and not have rationing. So you'll have something called pay for performance, or something called, in quotes, best practices, where a computer-based program will tell you, oh, this works here, this doesn't work there. And a lot of this is based on very weak data. So they're going to try to take a physician such as myself, where we've had 4 years of medical school, 3 years of residency, 21 years of practice. They're going to try to tell us how to practice medicine. And I'm not going to do that. The day that a government program tells me how many CAT scans I can order per year, I'm going to take my diploma off the wall, turn off the lights, leave the office, and lock the door.
Well, so you're going to walk away?
Absolutely. I'm going to advocate for my patient. That's what I was trained to do. And the day I can't do that anymore, I'm out of there.
So you would have to then, to figure out treatment, you have to go to a database and figure out what the conditions are, what the age of the person is, what's available under a new plan. Would those be the guidelines that would tell you how you can and cannot operate, literally, as a doctor?
Yeah, exactly. You're going to have to look at the age. You're going to have to look at diagnosis codes, whether the test is available. Let's say that the test is available, that I can obtain a CAT scan, but there's no CAT scanners around because they've all closed down. So there's lots of ways to ration. We have to remember, we have other countries where this occurs. We have Canada and England. And last time I looked, they were coming here for care. We weren't going there.
Yeah. Can you argue, though, on the flip side of this, that maybe some people don't need that extra X-ray? Maybe they don't need that MRI. And that's where, in effect, you could save the country a lot of money through the system.
Well, I think if we look, for instance, at the care of seniors, I look at patients over 75, we've so enhanced their quality of life over the past 20 years.
That's true.
Through coronary angioplasties, through hip replacement, through knee replacement. Look at the country. Look at the improvements in medical care over the last 20 years. You know, I think you have to really leave it up to the doctor. I always try to use my best judgment when I order a test. And a computer program cannot replace my judgment, cannot replace my knowledge of the patient. So really, this terrifies me, as it really should your listeners.
Listen, I've got about 30 seconds left here. I understand your position. You're against rationing care. You're against the proposals on the table now. But, I mean, it really is a system that's hurting for money and hurting for cash. And the longer we go through with a system like this, well, the more way we're going to have to figure out how we can save the money. What's your plan for saving health care money in America?
Well, I think that's a great question. Right now, the system works for 85% of the people in America that are covered that have insurance and basically like their plan. We've got to look at the other 15%. We want to increase their access. We want to correct insurance company abuses, and we want tort reform. So I think we've got a system that works well for most people, but you don't want to turn it on its head. You want to solve it piece by piece, and I think that can be done.
There are those who believe that health care right now is almost dead in the water. We'll see if anything comes out of the House this week. Others contend otherwise. Dr. Fink, thank you, sir. Live in L.A., getting up early for us today.
Thank you.
All right.